Hello, hello, hello. Welcome back. This is officially our week 6 now of being in the pandemic of the COVID virus for school, that is. All online classes now. So again, we've been communicating strictly through email, all right? Yes, I have posted a couple of things to Blackboard, but again, I prefer this email aspect just for this semester. Next semester I'll do things differently, but I like just posting the video, giving you a chance to watch it, and then reply back so I know that you've actually seen it and giving me some feedback that you are actually doing these assignments in the meantime as your participation and attendance. So make sure you're keeping up with that because, again, attendance is primary for this course. If you don't attend, you don't pass. So those of you that are behind, contact me directly, email me, let me know what's going on because I might have to drop a few of you here coming up. Sorry about that, but that's just the rules. We're going to get into the next chapter here that is going to be covering information on sudden illnesses part 4. So it would be considered actually substances abuse and substance misuse. Now last week we covered poisonings, bites, and bee stings. Those were great and all. You had good replies. I liked some of the information on bee stings, wasp stings, allergic reactions, diabetes, awesome stuff, you know, and you guys covered some information a little bit on substance misuse and abuse. Very good. So this week we're going to go straight into those things. Substance abuse and misuse will be the first video, so this is the first video of 2. The next video will cover information on heat and cold related illnesses. So without anything extra, let's just dive right into it. Okay, let's define these two terms. Substance abuse and substance misuse. So first off, substance abuse is a deliberate, a persistent, and excessive use of a substance without regard to health concerns or acceptable medical practices. So what's going on here? Okay, abuse. Somebody is deliberately and persistently using excessive amounts of, for instance, alcohol, right, without regards to their health, with their personal health, with their health of their family, so on and so forth, because alcohol can cause a lot more problems than just problems for that one person. We could also say that substance abuse would be somebody who takes not just one Xanax, which is prescribed to them, but 2 or 3 or 4 at a time. And then using something as a misuse, okay, this is going to be a little bit different. Substance misuse is use of a substance for unintended purposes and for improper amounts or improper dosages, okay? So let's say, for instance, we're talking about Xanax one more time. Okay, this can be an abuse, this can be a misuse, but let's stick with it as being a misuse. Okay, misusing an item is something like, okay, grandma has her medication and you take grandma's medication and start using it. Obviously, that's a misuse. Or somebody takes Xanax and alcohol together, they're not prescribed the Xanax, and they're misusing that substance to get a certain effect with that alcohol. Of course, we should never be mixing these things. So we have abuse. Again, abuse is deliberate, persistent, excessive abuse. Misuse is unintended purposes it's being used for. Now let's break these down into 6 major types, okay? The 6 types are, and we'll go through these each one by one, stimulants, hallucinogens, depressants, narcotics, inhalants, and last but not least, cannabis products. Those have been deemed separate now, thankfully, with this, since it's all mostly recreationally legal in most states here now. So we'll go over the first one, stimulants. These affect the central nervous system by increasing physical and mental activity. And I can think of one right off the bat that I bet all of us have had at some point or other in our lifetime already. And this would be caffeine, right? Caffeine is probably the most widely used drug in the entire world. Non-prescription drug, of course. Caffeine is a hell of a drug, you could say, almost. We see little kids, right, drinking their frappuccinos or coffees, and they're only 5 years old ordering these things, and they're on a caffeine high, right? Soda does that to kids too. What we're looking at is caffeine that is either man-made or caffeine that comes from a natural source. So a natural source caffeine would be something like a coffee or green tea, for instance. These are 2 great options to get a natural source of caffeine. But then we have man-made caffeine, which is called caffeine anhydrous. So if you ever look at the label of an item, it says what type of caffeine is usually in it. Caffeine anhydrous is man-made. It is strong. It works fast and hard, but you get that I don't know, that drop, that crash at the end of using these items most of the times. With a natural caffeine, it's absorbed through oil in the human body, so it actually causes it to work cleaner, more efficiently, maybe not as strong, but you get a softer letdown from it. So you get that better feeling of natural alertness throughout the entire day. Helps you prevent more fatigue. It can help suppress the appetite. And number one, why people use it, right? Enhance exercise routines. Research has shown that 250 milligrams of caffeine before athletic competition of any sort will actually increase your exercise capacity. So if you want to run fast, you can run a little faster with caffeine. You want to be stronger, you can be a little stronger with caffeine. You want more endurance and strength, a little bit of caffeine goes a long way. Now, taking too much is always a bad thing, you could say. For instance, here's a case study. Look at Sylvester Stallone from the movies Rocky IV or Rambo 2, 3. He was in the best shape of his entire life, he would say. Leanest body fat, like 1%, 2% body fat. Of course, it takes extreme dieting and extreme actions to cause this in the first place. If you watch some of his old interviews, he stated that he drank something like 30 cups of coffee a day for the last 2 weeks before they started filming their fight scenes, which is always when they're the most shredded. That was very dangerous, he said. He said he did not feel good. He felt like he had headaches all day long. Like he felt sick at times, shaky, couldn't get through the day very well. Of course, once that was all done, after they got all their fight scenes and all those filmed, he went back to eating better, more higher quality diet, just because he didn't have to have his shirt off the whole time for that. So some people do some crazy things for crazy results, right? Make sure you're very safe if you ever think about doing something even anywhere near that. Keep your hydration status up. Make sure you're having adequate amount of food and such then too. Now we can ingest these caffeine products in different ways. We can drink them, right? We can inhale them, we can absorb them, and we can also take them in pill form then too. Other stimulants that we're seeing are things that can also be like asthma inhalers. An asthma inhaler can be a stimulant for people. It's like a steroid in their lungs to help them absorb more oxygen, open up their bronchial pathways, the bronchi pathways, I should say, not bronchioles, but bronchi. So that way they can breathe more effectively. And again, it's bronchioles, sorry. It's those deeper structures that don't have actually any cartilage to keep them open. So we're looking at the bronchiole dilators. So some people will misuse these structures, these products. We'll get into other types of drugs. They all fall into different categories sometimes. The next one is hallucinogens. Hallucinogens affect the mood. They affect your sensations, your thoughts, emotions, and they also change your perception of your self-awareness sometimes. They alter your perception of space and time. They can produce a visual or even an auditory delusion, sometimes even like feelings, like sensations with touch delusions as well. Like, oh wow, bro, you feel so cool right now. It's just awesome, right? EDM concerts, go check it out. If you want to see that firsthand, EDM concert, guarantee you'll see some people that are on hallucinogens. So these can be magical mushrooms, right? Alice in Wonderland. Watch the cartoon if you want to get some more information on how psychedelic those can be. But there's also other things like Molly, MDMA is also what it's commonly called. This is essentially pure ecstasy, and these can be swallowed as a pill, so they can be ingested. They can also be inhaled then too. So sometimes people will take these pills and crush them up and then storm them up their nose. It makes it work stronger, but not as long for them. So their sensations might be extreme compared to somebody who swallows it. But of course, their trip isn't going to last as long when they're snorting it. If you swallow it, your trip's going to last a lot longer with stuff like this because it has to go through the digestive system. So sometimes a bad trip can happen, right? A bad trip is when somebody is fearful or panicking from whatever they took. They can be very paranoid with their delusions. Maybe people are watching them and they're freaking out about stuff like that. They're having very vivid hallucinations where something's after them that's not even there. They could be profoundly depressed. They get this really squirrely feeling in their stomach where they just feel nauseous and scared. So they get a lot of anxiety and tension. They could become angry possibly. This is where you want to keep somebody like that, right? Maybe separate from other people. Try to calm them down. If you can't calm them down on your own, this is a good time to call 911, get some help. But other things they might do, they might feel threatened by others who attempt them. They might feel threatened by others who attempt to help them. So if you're one that's trying to help them, you tell them who you are, you're certified, maybe you could be their best friend or something like that. They could be very irritated, they could almost try to hurt you. So again, this is a good situation to get away, maybe call 911. Depressants. Depressants affect the nervous system, the central nervous system, by slowing it down. And the most common depressant I'm sure we all know about is alcohol. So these depressants are commonly used for medical purposes, right? They're usually like medications for depression and different types of anxiety that people have. So depressants can relieve the anxiety. They can promote people's sleep patterns. So they get more rest. It can depress the respiration rate, right? So think about that too. If somebody takes Xanax and alcohol together, they are really depreciating their respiratory rate. They could stop breathing. They could need CPR very quickly. They need 911. They need their stomach pumped probably right away, and continuous watch, right? And probably rehab. Anyway, these depressants can be used for pain relief, for relaxing muscles, and another thing that they do, though, they impair somebody's motor control and also their judgment. So this is why you should never operate motor vehicles or anything kind of heavy machinery on any depressants, because bad results can happen from those things. Now these depressants, they can be ingested, swallowed, or they can be injected as well through the veins, so intravenously with a syringe. Like I said, alcohol is the most widely used depressant out there. Not just used, but abused as well. In the United States, that is, but also in the world. And then chronic drinking, it can actually cause damage to your brain long term, damage to the liver long term, scar it all up. You ever heard of people pickling their liver? That means their liver's destroyed basically from trying to metabolize all this alcohol, and they start to look old a lot faster than most people. You'll notice that. The liver has a lot to do with keeping your skin supple and smooth and making sure you're getting rid of toxins from your body. If you can't get rid of toxins from inside the body, it's going to have an outward expression on the skin, for instance. So smoking, drinking, we know those things cause a lot of outward problems. But we see that alcohol, as I said before, causes a lot more problems than just for that person. It can cause a lot of psychological problems for that person. It can cause family problems, problems at work, problems socially. Number 4, narcotics. If you watch the TV show called Narcotics, one common used narcotic is cocaine. So what these do is they work together. These narcotics, they work with the nervous system to relieve pain first and foremost. They're usually illegal without a prescription. And in large doses, whether they're snorted or swallowed, they can cause extreme euphoria. They can cause you to be a little stupor, like dead to the world almost even if you take too much. They can slip you even further into a coma where you're out of it completely. And a coma can lead to then eventual death if too much of these things are taken. The 5th one is an inhalant. An inhalant covers a lot of bases, you could say. Inhalants produce a mood-altering effect and depress the central nervous system. Inhalants can be used to use can cause damage to the heart, it can cause damage to the lungs, it can cause damage to your brain and also to your liver. So breathing these in, it's not always a good thing. Like different aerosols people even breathe in sometimes. If you look up that guy Steve-O from Jackass, he used to do these things called whippets, and he'd take CO2 cartridges and he'd inhale those, right? And he'd be like stupor to the world, right? He'd be like stuck, he'd be shaking maybe, he'd have this drool coming out of his face, he'd be stuck there for 20 seconds and then all of a sudden he'd come back to it. But he's still all messed up, giggling, freaking out, doing stupid things, right? No wonder he's on Jackass. Anyway, these are some of the things that it can also cause. Swollen mucous membranes in the nose and mouth, right? So it could impair breathing possibly. It can cause hallucinations. It can cause erratic blood pressure, so severe highs and severe lows. And it can also get to that point where, like I was saying with Steve-O, seizures, so shaking violently for a few seconds at a time where your body's just stuck. Last but not least, number 6 is cannabis products. Thank God we've changed the name of these to being recreational and for medical purposes now oftentimes. They're not just deemed an illegal drug anymore. because this oftentimes doesn't cause a situation where we need to call 911 for. You'd have to have extreme amounts of this in your system to cause the hallucinations or the fear, anxiety to deem it necessary to get somebody to the hospital with this stuff. In fact, a lot of these oils are put under children's tongues that have seizures, and it'll stop their seizures altogether. So it's a really amazing compound being studied. Of course, we always want to say this: too much of a good thing can be a bad thing. So if you are going to be experiencing these substances, be careful at first. Use small amounts and maybe slowly learn about how much you can consume on a safe basis if you're using for the correct purposes. So marijuana, it used to be the most widely illicit drug. Now it's probably the most widely non-illicit drug out there now, since we're deeming it more and more safe to be practiced with. But these are the effects of marijuana. First off, they can get feelings of elation, happiness. They can have distorted perceptions of time and space. They can feel like they're almost floating outside of their bodies. Their judgment could be impaired. Their motor coordination could be slightly impaired. Throat irritation, right, because you're coughing from smoking. They could have red eyes. They could have dry mouth, dry eyes. They could as well be very hungry. That's a side effect, right? So it's good for certain patients, like cancer patients, if they want to regain their appetite. It could increase your pulse rate too. It could make you a little dizzy because, again, you're inhaling smoke. And then it'll also, some other times it will have some effects. Sometimes people could actually break out in hives from that anxiety going on. So we have to think about those things that, okay, they're just having a scary time because they've never tried this before. It's anxiety. But again, marijuana, 9 times out of 10, we don't have to call 911 or anybody about that. That's just something that's going to be in the system for a couple hours, and it cuts out pretty quickly usually. There is one other type of drugs we want to get into, and these are the designer drugs. I know this isn't on the list of 6, but this is the 7th one. In designer drugs, we're looking at things like narcotics and amphetamines that have been altered or man-made to create a certain type of experience. That's where we're talking about the Molly, the MDMAs, ecstasy. We're looking at things like drugs that cause these extreme amounts of perceptions in the human body. Sometimes these substances are obtained and first are used for medical purposes, but then their purpose has been modified after that. Let's see, ecstasy, like I said, is one of the most commonly used ones. And these are the effects of ecstasy. A very euphoric high you get. Increases blood pressure. The heart rate's going to be rapid. They're going to be sweating like crazy. You're going to have locked jaw. People are going to be chewing on things. They're going to be extremely thirsty, possibly. They could have distortion of their senses. They could have very erratic mood swings from highs and lows even, and they could be severely paranoid. One other one, I know there's a lot of different types of drugs, but we also have anabolic steroids, and these are utilized for muscular performance, increasing muscle mass. We hear a lot about sports athletes using this stuff. So chronic use of these things can lead to sterility, can lead to liver cancers, it can lead to personality changes, and it can also disrupt your normal growth if you're using them too young. Some of these are metabolized in the liver if they're swallowed. Some of these are injected, so they are absorbed to the musculature and also to the bloodstream and the fat. Main thing is that these are always considered dangerous. They should be doctor prescribed, regulated as well. So it's better to be safe than sorry. There's all the testosterone in the world you have, guys. If you really do have a problem, you go to a doctor to fix that, all right? Over-the-counter substances can sometimes be misused. So we're looking at aspirins, we're looking at ibuprofen, so we've heard of Aleve, Motrin, all these different substances. Sometimes people can take too many, right? That's the big thing, is the substance abuse. So we need to be careful. Nasal sprays can sometimes be these items that can be misused. Inhaling too much of that. Laxatives can also be something, as well as emetics. So things that cause you to create bowel movements and flush your system. And with emetics, they can cause dehydration. Same thing with laxatives. I knew a woman when I worked at GNC. She would come in and buy a huge bottle of sunleaf extract, which is a natural laxative, and she'd take 10 times the recommended dosage every single day. And this is something that should be just used maybe at a regular dosage once or twice a week. And she went from being like a normal looking lady to skin and bones in no time. And she was just constantly stripping her body of any nutrient that she did ingest, depreciated her calories, dehydrated. These cats are crazy today, sorry. But the main thing is, if you need a laxative, right, drink more water first and foremost. Eat more fiber in your diet. If those two things don't work, then you add a laxative, and don't do too many. Signals and behaviors, okay, we're looking at the signals are like the changes of the behavior that not otherwise are explained. We can see a sudden mood change, we can have restlessness, maybe somebody that's very talkative or irritable. They have changes of consciousness, maybe they're coming in and out of consciousness. They could have very slurred speech and poor motor coordination. Their skin could look very moist or even flush appearances. They could have chills, they could be nauseous, they could be vomiting, they could be very dizzy, they could be breathing very abnormally. So all reasons why we consider signals for substance abuse or misuse. Some other things we can look into then for overdoses. So signals of, for instance, like an alcohol abuse overdose. The person is completely blacked out, right? They are looking at you, but they're looking through you by chance. They could be violently vomiting. They could be hard to wake up. They could be just completely unconscious, not moving at all. We know that alcohol is a very dangerous drug when we consume far too much of it. So that's why it's very, very important to never get to that point of overdosing. Withdrawal symptoms, we might as well check into those. With withdrawal, somebody could be confused, they could be violent, they could be restless, they could be trembling, having hallucinations as well as seizures. The main thing that we're going to do for most of these, okay, when they are considered a major concern, we're fearful for the person's safety. We check the scene for safety. We do not approach the person if they feel like they have threatening behavior, right? But if it is safe, we call 911. We help the person as much as we possibly can in the meantime. So if they're unconscious, we check for breathing, check for circulation. Give them CPR if necessary. Find out from around them what's going on. I had a problem where this happened one time. I was at North Avenue Beach. There was this kid there drinking alcohol. Nobody told me this, but they were actually experimenting with some other drugs like Xanax. Well, this kid overdosed on Xanax and alcohol. He passed out on the beach. His buddy was holding him, cradling him, about to stick his fingers down his throat. I said, whoa, 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 hold on. We don't do that. That's not what we do. We got to lay him down, check for breathing, because he looks like he's turned a little blue. Well, he wasn't breathing at all. Right when I was about to give him his first set of rescue breaths and CPR compressions, right, I get tapped on the shoulder by a lifeguard. Right then I knew, okay, he's the most well-certified person for this situation. He's going to take over. My job now is to call 911 and assist him. I called 911. We had an ambulance there within 5 minutes. They pumped his stomach, got him awake, took him to the hospital, put him in rehab. So what we can always do, right? We can call 911. That's for the extreme cases. When we're having trouble breathing, irregular breathing, we have persistent chest pain with the person. They're vomiting up blood. They're acting violently. They are seizing. Other times we suspect a misuse, maybe, or there's no signals that are present that you suspect of a substance abuse. We can call the PCC, the Poison Control Center. They'll give us some good directions, tell us on what the person should take to help remedy that. We can find out, what the effects are with how much they took. We can calm the person down. We can keep them from getting overheated, overchilled, and just help them get through the situation, their bad trip. If you ever suspect a designer drug has been used, make sure you tell the EMTs when they arrive, right? Always let them know as much information as possible to help the person. Now, once in a blue moon, there is unintentional misuse, right? Maybe a child gets a hold of this stuff and they think it's candy or something like that, okay? What we can always do is read the product label if there is a label and use only as directed. We can find out more about the side effects of these substances if they're used. We can see if there's any possible interactions with other things. But the main thing is we keep them in the proper containers, out of sight, out of mind, locked away from kids. It's a big thing. Anytime you have an old medication, per usual, you can take it to CVS or Walgreens. They have an old medication deposit. You can throw them out there. That way they're done safely instead of down your toilet where it gets into possibly our water supply, right? That's enough for video 1. That is substance misuse and abuse. We'll jump into part 2 now for today, which is going to be heat-related and cold-related illnesses. So stay tuned. Check the next link. Thank you.